Jay Somran, hello and welcome. We have still got people flooding into the lobby, but thank you for everyone that has joined this webinar this evening, which is on prioritizing your heart health. This month, which is Heart Month, is very fitting for our talk tonight, which is about prioritizing your heart health. And we thank you all for joining. My name is Nirav. I'm a GP and a volunteer in our healthcare team. And with me is Dr. Niket Patel. Dr. Niket Patel is a consultant cardiologist and a clinical lead at the Royal Free Hospital in London. He's also an associate professor at UCL. Now, this webinar is a part of a larger initiative that is called BAPS wellNESS. And we've been exploring how to improve our nutrition, improve our posture, increase our physical activity, as well as building positive habits. Now, this project has been inspired by our gurus, Pujya Pramukh Swami Maharaj and Pujya Mansai Maharaj, who have both been keen advocates of healthy eating and lifestyle. And their teachings and personal examples serve as an inspiration to us to maintain a healthy body and spirit. Now, unfortunately, as we know all too well, the South Asian community, and especially our Indian communities, are disproportionately affected by certain health conditions, such as diabetes and heart disease. So promoting a healthy lifestyle from a young age is really critical for prevention. And we all recognize the importance of taking a well-rounded approach to healthcare, addressing those physical and mental aspects. And with this in mind, the BAPS wellNESS focuses on 4 key areas that support our good health in the long term. And that's nutrition, that's the N. E is for exercise. Sleep is the first S, and second S is for stress management. And over the past few months, we have been taking part in webinars that are focused on nutrition, diabetes, exercise, and habit formation. But today, as you know, and why you're all here, is about prioritizing your heart health. So we're fortunate to have Dr. Niket Patel, who will be sharing his insights and answering your questions. We'll now hand over to Niket Bhai, who will speak to us, followed by a Q&A session. So feel free to type all of your questions into the chat through the webinar, and we'll get to them at the end. Niket Bhai, over to you.
Oh, that's very kind. Thank you, Nirav, and to the organisers for giving me this opportunity to talk to the community about what I feel very passionately about, and hopefully we can work in an interactive way to see if we can move forward in improving all of our health as a community. So the focus of this talk is about prioritizing one's heart health. And if I can move the slide. Yeah, so what I'm going to do today, I mean, I have a particular perspective on heart disease, treating heart disease for most of my professional life. I have a certain perspective on this, and it allows me to kind of reflect on perhaps what we can do as a community, as individuals, to prevent heart disease. So what I'd like to focus on today is about lifestyle changes and look at why heart health is important to address, how one can reduce one's risk of developing heart disease, and where to find trustworthy information, which can often elude us all, and we can always get confused about where and who to trust when it comes to seeking medical advice. So when I thought about this talk, I want some of the things that I think are important in cardiology are not necessarily the subject of what we would need to discuss today. And really, as I said, I want to focus on lifestyle changes, about changes that we can make to prevent disease, rather than talk about the medical treatments or the interventions that one can do once people develop problems. So why is heart disease particularly important for us to focus on? Well, we can talk about, in principle, heart artery disease, which is basically when people get a narrowing of the heart arteries through deposition of kind of inflammatory and fatty material in the walls of the arteries, which can then progress and cause things like chest discomfort, angina. But if one gets a break in the lining of that artery where this material is collected, then a clot can develop pretty rapidly. And the risk is, in that setting, that people get an interruption in blood supply to the heart muscle, and that is what causes a heart attack. And this is what we're trying to address. This is what we're trying to reduce the risk of, because of course a heart attack has a significant impact on people's quality of life, but also the quantity, how long one lives as well. So what is a heart attack? We've talked about what the mechanism of that is, but really, one needs to be focused on what symptoms people get if they were to have a heart attack. And people have obviously seen this, typical description of a heart attack, which is this tightness in the chest. But I'd like to remind those attending that it's not only a chest discomfort that can represent a heart attack. So not just chest pain or chest tightness, but sometimes you can get discomfort in your neck, in your jaw. Pain can radiate to both your arms. It can be associated with feeling sick, feeling sweaty, feeling breathless, feeling uneasy. And the important thing is that if you're concerned that any of these symptoms are happening, then it's important to seek help rapidly, and that's to call 999, not to waste time in that maneuver, because time is very critical in this situation. So is chest pain the only symptom of a heart attack? No. And I'd like to draw people's attention to this, and I come across this regularly, so I'd like to draw attention to the fact that it's not just chest discomfort that people need to be mindful of. I have I'm fortunate to be in a position where I can help people with heart attacks. People come quickly to a heart attack center like my hospital, where we're able to help people open up, help people restore blood supply to the heart muscle. And a few weeks ago, I came across a gentleman that was 35 years old, Indian man, who developed sudden chest discomfort. We found a blocked artery. We opened that up, and afterwards, I had the chance to speak to him and reflect on how such a young man had led to the operating table where we needed to fix his artery. And it was quite clear that he reflected on his childhood. It's often these habits and kind of ways of thinking develop very early in people's lives, about what a healthy perception of a person is. So sometimes, and he was often encouraged to be overweight and plump and so on. And I'd like to challenge the audience to think of which child here they think is most healthy. And often in our community, we find that, sometimes we lean towards a kind of a slightly overweight child, or a child that is healthy in perception, in our perception, as the one that is stronger, fit, and more robust. But actually, I'd like to challenge that perception, because actually it can be quite harmful that we encourage our children to develop habits early in their lives that can then later have impactful changes or impact in their health later. And when talking to this gentleman, it was quite clear that he had developed adverse lifestyle habits that kind of made him overweight, perhaps have the wrong metabolic profile. He played a lot of video games. He ate a lot of fast food, fizzy drinks. He had a lot of sugar in his diet, and absolutely did not exercise. He ate lots of snacks and so on. And these habits were reinforced early in his life, which then persisted into his teenage years. And that's where I'd like to focus as a perhaps intervention that we can do to reduce one's risk. And it's about changing those lifestyles. And as I'd like to introduce 7 steps to try and introduce a healthier lifestyle to reduce one's risk of developing heart problems. Smoking cessation is one, eating a healthy diet, watching one's cholesterol, blood sugar level, blood pressure, looking at physical activity and addressing any kind of weight issues would go a long way into reducing one's risk of developing problems. So to address that first point about smoking cessation, I think I'm talking to a converted audience. It is not rocket science for people to recognize that smoking is bad for you. There are thousands of toxins within a cigarette, and it's damaging to the whole body. This is well recognized, and your chance of developing heart disease increases significantly if one's a smoker. Importantly, you're 4 times more likely to give up smoking when you seek help, and help is readily available through your general practitioner and various mechanisms, including your pharmacist. And there are nicotine replacement therapies that can help people overcome the urges of smoking. And I'd like to urge people that if there's one intervention to do, then it's this, to stop smoking if one is already. And it's quite well recognized that, it's not too late. If you follow people out to 15 years, then you can reduce your risk to someone who has never had a cigarette. So it's not too late to stop smoking. It has positive effects on reducing your risk of lung cancer and heart disease out to 10 to 15 years. But nonetheless, there are earlier kind of advantages as well. I'd like to draw people's attention to eating a balanced, healthy diet, having less saturated fats, not to add salt into their diet, and eating a kind of varied diet with fruit and vegetables. And it's important to recognize that in 2025, there's a lot of food that is processed and not whole. If your grandmother doesn't recognize it, then it probably isn't the type of food that's healthy for you. You need to be able to recognize whole foods on your plate and eat a balanced diet. Everybody knows that there are less available everything we buy in the supermarket that gives nutritional information. And just like everybody else, people tend to pick up things that are tasty or things that they prefer. But I'd like to encourage people to look at these labels, because sometimes they're very readily, easily, you can identify foodstuffs that are bad for you. And it's quite clear, for example, in this of oven cooked pie, the fat level is very, very high indeed. And sometimes they have traffic light labels on them. I get asked, are there any particular foods that are particularly healthy or beneficial for heart disease? We know that from various studies and trials that omega-3 fatty acids are actually protective in terms of heart disease, and actually we should encourage people to have that. But within our community, it can be difficult or perceived to be difficult to get omega-3, particularly as it's more readily available in seafood. But there are vegetarian sources for omega-3, walnuts, flaxseed, chia seeds, and so on. So I'd like to encourage people to look at kind of healthier and vegetarian sources of omega-3. And there are supplements that, of course, are available and probably easier to get enough omega-3 in by taking these supplements through various health food shops. Cholesterol. Now, this is a big one, obviously, that everybody recognizes that, having a high cholesterol is bad for you. Not all of the cholesterol in your blood is bad. There is a good cholesterol and a bad cholesterol. When you have a blood test, it's your total cholesterol that people often band, but it is in particular important to recognize what one's LDL cholesterol, low density lipoprotein cholesterol, is, because that's the one that's particularly bad and adverse for people. And so it is quite important to sit down with your doctor and others to work out whether you have an adverse cholesterol level and look at ways to address that. And here, in terms of lifestyle, in particular, given this talk is about that, you want to stay away from, clearly want to stay away from saturated fats, of which they're usually dairy products and so on, that I think we can all recognize, including ghee and cheese and butter and cakes and so on. But in this modern world, we get exposed to lots of other very toxic fats, to be fair, trans fats that are very bad for you, that are available in fast food and processed foods in general. There is legislation coming through that we might restrict the presence of some of these very toxic chemicals that didn't exist, as your grandmother wouldn't have recognized those. But it is also recognized that reheating oil, so reheating vegetable oil can increase the amount of trans fat that one's exposed to. So I'd really like to draw people's attention to the fact that reusing oil is turning out to be a very bad thing to do. There are healthy fats or healthier substitutes. Unsaturated fats are good for you, from olives, olive oil, nuts, seeds, avocado, walnuts. So there are alternate sources of more healthier fats to kind of seek out. So blood sugar. Now this is something that people recognize is, I hope recognize, is a very toxic thing. One's need for refined sugar in a day is actually quite low. You're advised to only have 30 grams of sugar in all your food total for the whole day, and so not added sugar, but all foods should include only about less than 30 grams of refined sugar. And I think this is a hidden toxin that people that we all fall victim to. So we need to be mindful of where that sugar is coming from. And if you have diabetes, then diabetes is a particularly harmful condition that increases your risk of heart disease and other problems, but heart disease by 2 or 3-fold at any cholesterol level. And it's important as a kind of prevention measure to ensure that you do your best to control your blood sugar, and that involves dietary changes, but importantly medications. I regularly, as I'm sure most of the audience kind of recognize, when you go to dinner parties and so on, that regularly Indian sweets are brought at the end of most meals, and we always, I hope that I'm not speaking out of turn, but it's always that you will always spot most diabetics within our community cheekily having a Indian dessert as a treat at the end, and it often is slightly demoralizing and depressing to see that that kind of self-control, even when there's such a harmful disorder, is kind of quite prevalent within the community. And I hope that I think it's not just my friends and family that I see this in, and I suspect it's ubiquitous within the kind of community. So just be mindful of the messaging around that, and the message you send to other people with diabetes, and how you might want to look after your own blood sugar levels. Keeping a healthy weight. Now, this is really important, and it's a subject of quite intense kind of talk within the prevention community and within the kind of people's it's readily in people's minds, but it's important to recognize that weight, the number on the scale, is not the only thing that's important. In this diagram, in this picture, you can see a gentleman that probably weighs the same as the other, but obviously one has a adverse body shape compared to the other, and obviously body percentage fat plays a significant role in adverse outcomes. So you really need to think about what your weight is made up of. Is it muscle? in which case you're doing very, very well. And if it's fat, then that's where you need to focus on trying to improve your lifestyle so that you reduce your risk of developing high blood pressure or diabetes in particular. Both of these conditions are several fold more likely if you're heavy. So it can be challenging for you to work out which body shape you are sometimes, but an easy way is to track your waist size. This is something that is very clearly linked with an adverse body shape and an adverse body weight. Blood pressure control. Now, this is something that's very important and a silent problem. High blood pressure leads to damage to arteries and affects several organs in the body. And in the community, in clinic, when measured, blood pressure should be less than 140 over 90 millimeters of mercury. And in those with diabetes, kidney problems, or heart disease, I would suggest that blood pressure reading should be lower than that at 130 over 80. So most people are used to these sorts of numbers, and probably not losing the audience because they readily know, these kind of numbers and what numbers they have. But it's important to recognize that actually your average blood pressure is far more important. Your average blood pressure is more reflective of what your true blood pressure is. One's blood pressure can change from moment to moment in reaction to lots of stimuli, pain or stress and so on, sleep deprivation. Everything can contribute to changes in your blood pressure. So it's important to take an average blood pressure. And what I tell most of my patients in order to try and work out where they are in this whole kind of sea of changes in numbers that people get is to take their blood pressure several times. So to take a seat, to relax, to take one's blood pressure 3 times, and to absolutely ignore the first 2. Only record the third of 3 recordings. So only record the third blood pressure. Do that twice a week at random times, and importantly, random times, because then we get a good reflection of what one's blood pressure is over the course of a day. Collect 2 weeks worth of these recordings, write them down, take an average of these, and you can calculate that if your blood pressure is above 135 over 85, having done all of this work, then you really need help, and you probably need to take that piece of paper to your general practitioner, because that means that your blood pressure is not within what we would hope it to be. But doing this piece of work is really, really powerful. It really gives you a really good idea about where you stand in terms of your blood pressure control. And there are various lifestyle measures that people can kind of deploy to address blood pressure, including weight reduction, reduction in salt, reduction in alcohol intake, and increasing one's physical activity, amongst obviously medical therapy, which when this is not the subject of this talk. People often ask, are there symptoms of high blood pressure? And it's really important to recognize that usually high blood pressure does not have any symptoms. Okay, most people with high blood pressure will have no symptoms whatsoever, and they can have that high blood pressure for a long time and develop no symptoms until they have issues with regards to damage to organs in the body, so kidneys or heart and others. So so it's important to measure this number. And I think, in 2025, I think most people recognize that the number is important, but really what to do with that number and how to translate that into your individual status is probably more important. And that's why I go back to taking an average blood pressure of several recordings over several days is very powerful indeed. There are symptoms of a dangerously high blood pressure, which happens rarely. And those can be, severe headache or visual symptoms, dizziness, chest pain, feeling sick or breathless. And if these things happen to you suddenly, then it's important to seek urgent attention or take your blood pressure, borrow your family's blood pressure machine to have it measured to see if it is dangerously high, which might be a cause for these symptoms. I get asked, is a low salt diet only necessary if you have high blood pressure? Now, I mean, this is quite a interesting thing in that obviously high salt diet can increase your blood pressure, and it's important to recognize that everybody should be on a normal or low salt diet in order to reduce one's risk of developing high blood pressure or putting strain on the body. I get often a retort, or sometimes people say to me that, oh no, I need some salt in my diet. Surely I cannot survive without salt. Salt is a necessity. And that's true, but actually the amount of salt required to survive, to be healthy, to be normal is actually very, very small. You don't actually need very much salt indeed. So you don't actually need to add any salt to your diet. Often you'll get enough salt. If you eat a varied diet, you'll get enough salt from your food. You don't need to add salt. And the upper limit is actually very small in terms of the normal intake of salt, which is only a teaspoon of salt per day in all your food. This is not added salt. This is just the salt required to be healthy. There are there are lots of hidden salt within diet, so you can not add salt to your diet and you think you're doing well, but sadly, with a lot of processed foods, uh, snacks and takeaway food, sadly there can be a lot of hidden salt within that, and people can fall ill of this, not knowing that they're inadvertently having a lot of salt in their diet with soy sauce, pizzas, canned soups, frozen vegetables. Various little bits and pieces can get you can get into a high salt diet very readily. And so it's worth looking at kind of having a natural varied diet that includes whole foods, and really you should limit the amount of kind of processed foods or fast foods in your diet. So to talk about physical activity, now this is really important because it helps reduce one's cholesterol, reduces helps control weight, but you can't exercise yourself out of a heavy weight. You really, principally weight is driven by the calories you take in. Your body's a very efficient machine. Actually, you can do a lot of exercise. You would have to do a lot of exercise to burn calories that would outstrip a bad diet. But it helps in reducing weight, improves the quality of life, helps sleep, helps stress, helps better sugar control. When we look back at the previous slide about body shape, muscle is a very sensitive tissue to insulin. And so what I mean by that is that if you have if you have borderline diabetes, or you have diabetes, the more muscle percentage you have more reactive tissue to absorb that sugar than if you had more fat. So it's exercise and building on a good body shape, or reducing your body fat percentage, is actually very, very important as a health maneuver. People ask me, how do I start? What do I do? Well, the advice is that you at least do 30 to 40 minutes of moderate intensity activity most days. And people ask, what is that moderate activity? Well, physical activity that's moderate makes you feel warm, you breathe harder, you make your heart beat faster than usual. Often it's about being able to do that activity, but continuing to be able to talk. For example, you can say 2 sentences without gasping or stopping. That can often be a predictor of kind of a moderate level of activity, and you should sustain that activity. It's important to start, if you've been naive to physical activity for a long time, it's important to recognize that you start low in terms of intensity or duration, but that it's not that's where you stay. You must improve, and you must try to develop an aerobic exercise program that involves you increasing either the intensity of work you do by making it longer, or that you do something faster or more intense, or you do it more often. And so that you're constantly increasing your physical activity, so that you're constantly improving your aerobic capacity. This is where you get most of the gain. It's not about jumping into something that clearly is outside of your comfort zone. It's about building. And this is something that I think most of us can achieve, as long as we have that kind of mindset and focus. One of the most important questions I get asked is, what are the guidelines, or what kind of restrictions should I have in my exercise program if I already have a health condition? Now, this is something that you can't answer broadly, and is very specific to an individual. And you should seek medical advice from your cardiac rehabilitation team, a cardiologist, or a general practitioner as to how to define what your exercise regime should include. Remembering that everybody's conditioning is different, right? You can be a marathon runner before you developed a heart condition, and that exercise program will be very different to someone who's elderly and frail. So it very much specific to the person, but also to the condition and the severity of that condition. And it's hard to find advice, but I would really advise people to look at this website with the British Heart Foundation, who have managed to simplify advice around this and actually go into detail into specific conditions and prescribing exercise programs for specific conditions and severities. Importantly, you are asked not to refrain from activity. It is important to continue to remain active despite having a heart condition. So it's important to do activity. What the restrictions around that are, or the upper limit, generally we need to make that more specific to you as an individual and your condition. But in general, it is usually safe to continue moderate activity where you can sustain that activity and still speak. So that level of activity is usually very safe in most heart conditions. But I'd advise people to take a note or take a picture of this QR code to be able to kind of look at one's own specific condition. So finally, I'd like to just touch on a personal kind of worry that I have and thoughts I have around social media. Now, in this age, we are exposed to information by various means, and I think that we can fall foul of being exposed to sometimes less than helpful advice, but more importantly, harmful advice. And I've come across over the last couple of years this various very harmful social media messaging, WhatsApp messaging, and others, including Facebook and so on, where the messaging can be incredibly harmful. So I'd like to draw one's attention to some of these to focus on the fact that we really need to seek advice from trustworthy sources. This myth here was about cough CPR, where if someone's heart was to stop beating, then coughing would allow them to continue to remain conscious and would save their life. This is absolute and utter rubbish. This does not occur. This can be incredibly dangerous and harmful if people think that they can treat themselves by this mechanism. Another I came across, and I hope that this will play for us, yes, is a social media post where there is an individual that's passed out, and it said that they had a cardiac arrest and they're being resuscitated by slapping the inside of this person's elbow, and that a life was saved in doing this. This is an incredibly harmful message, and I know that our community is exposed to these as well. So I just want to draw your attention. This sort of thing is incredibly harmful. The delay introduced in doing things like this that are completely ineffectual in a heart attack or in a cardiac arrest is incredibly harmful. So and it can be very convincing. I can understand why people want to share messaging and help one's friends and families to kind of to save lives or to help people develop healthier lifestyle, but just be mindful of where that information comes from and look at more trustworthy sources. So what is a cardiac arrest? And a cardiac arrest is when someone's heart actually stops beating. You can't cough yourself out of that. You can't slap the inside of an elbow in order to resuscitate one from that. It's different to a heart attack. A heart attack, as we talked about, is an interruption in blood supply to the heart muscle, but that can lead to a cardiac arrest where one's heart stops beating. So one can cause the other. If you find someone unresponsive, the important thing is to call for 999, immediate help. Ask for help from someone. Ask them to make that call. Check for a pulse and start CPR if cardiopulmonary resuscitation CPR, if that's needed. But importantly, get help and seek emergency help before doing anything, because time is of the essence. And talking about cardiac arrest, without immediate treatment, so cardiac arrest when the heart stops beating, without immediate treatment, 95% of people will die in that setting. If there's a defibrillator used and people are able to do CPR within 3 to 5 minutes of that heart stopping, then you can increase survival from 6% to 74%. You can make a massive difference by learning CPR. And sadly, only 22% of people in the country are confident to perform CPR. And the Mandir has done quite a bit of work in encouraging people to learn CPR, to engage with that. And I think there's been a lot of interest around that. And you can learn to do CPR free at this British Heart Foundation website can link you into those kinds of training with this QR code. And importantly, in London at the Mandir in July, I'm told that at the summer fair there will be opportunity for everybody to learn and make a huge difference to the risk profile and actually, change the chance of someone surviving a cardiac arrest. So I've talked about where information can be difficult or misleading and in some cases harmful. So where can we get reliable information? And you can get that from these websites, from the NHS Live Well website, the BHF, the British Heart Foundation website. And actually, importantly and interestingly, the BAPS charity have had a number of videos posted on YouTube about lifestyle measures, and they were posted during the COVID pandemic, but are very applicable now as ever to reduce one's risk. And I kind of perused through them and found them to be very informative. I think they're very useful and they're very easy to understand and engaging. So I think I would really advise people to just click on a couple of these videos to help understand, the best lifestyle measures that we can deploy. And if English is a second language for you, then on Google Chrome, it's only a couple of clicks on Google Chrome that will translate that website for you into any language, including Gujarati. And so you're really able to then, I hope that English itself would, as a second language, isn't a barrier to having good quality information. So I'd encourage people, I don't have shares in Google, but if I'd encourage people to get Google Chrome and make these translations for friends and family so that they can readily get this information without hindrance. So look, I'd like to, thank the organisers for giving me this opportunity. I'd like to thank you all for listening. And I've left some of these QR codes here for if people want to take screenshots to access some of the websites that I've talked about. So thank you so much for listening, and I hope that that's been helpful.
Thank you. Thank you so much, Niket Bhai. That was fantastic. I think we've got over 200 people online and a huge amount of conversations in the chat, which we will endeavor to get through as many of them as possible. Let's start with a few quick fire questions, if you don't mind. So you need to do intense cardio workouts to benefit your heart. True or false?
No, and not necessarily, right? You need to be active. You need to have, be active in your daily life. That's the most important thing. Intense activity, the intensity of that activity is person specific. A 25-year-old walking for 45 minutes 2 times a week is not enough. Um, uh, Whereas that would be very, very good for someone who has frailty issues and is elderly. So it's very person specific.
Brilliant. What types of exercises are most beneficial for heart health, and how much would you say is recommended per week?
At least 3 times a week. Sustained aerobic activity is good for you. Consider creating that in your lifestyle. Focusing on your health. Try sustained aerobic activity like yoga, cycling, cross trainer, swimming, Pilates, these kinds of things. They're sustained aerobic activity.
And if I have a heart condition, or if someone has a heart condition, should they avoid exercise? I think we touched on this a little earlier, didn't we?
No, yeah, exactly. I think it depends on the severity and the individual. But remember, in general, if you're able to talk and sustain that activity, then it's usually safe to do so. Yeah.
You mentioned the importance of weight loss. I think we all recognize in our community how hard that is. Weight loss injections are now available. Should they be a real consideration here?
Yeah, I mean, look, weight loss is a behavior thing, and it goes back to that 35-year-old that I mentioned in my talk. It's something that we instill at a young age and develop. It's a behavioral thing, weight gain. In general, and there are rare conditions where it's not. Uh, I think these injections are really going to be useful, really, really helpful, beneficial to those that are overweight, in particular in those people with diabetes. And in the NHS currently, I'm told that they're available readily for people that are overweight and have diabetes. But these injections are not available on the NHS as yet for those that don't have diabetes. But I would hope that changes very soon.
Um, and in terms of a low salt diet, is a low sodium diet really necessary if you have high blood pressure, or are there alternatives that we could use to having low salt?
Yeah, there are these kind of salt substitute type salts. They often have a lot of potassium in them. I mean, you've got to be mindful of whether you have a potassium problem or whether you're taking medications that increase your potassium. That can be harmful. Um, the other thing is it's better than having sodium salt, but
Mhm.
it probably isn't as good as you think. It's not going to be the panacea. It's not going to be you know the treatment for this problem. I think it's going to be about self-control and about controlling the amount of salt. Importantly, your taste buds change. So I
Mm.
would, you've got to give it time to change so that you become used to a lower salt diet, and then everything doesn't taste bland. But
Yeah.
certainly over that first couple of weeks, you're gonna feel that difference.
Yeah, absolutely. I think for the Satsangi audience here, there's Gunatitanand Swami and say Swami Vata talks about we all need a bit of salt, and I think that gets taken in a bit of excess over time. But you're absolutely right. If we're trying to reshape our taste buds as well, it will get used to it over time. Um, what age do you think that people should start to think about their heart health? What risk factors are there for heart disease in these younger adults, really?
I mean, heart disease is more prevalent in people of South Asian origin. Your general practitioner will probably contact you. People like Dr. Amin will contact his practice would contact people when you turn 50, or people get focused around 50 as being an age that, well, better get checked out. But actually, I think probably all of us need to start looking at this sort of thing in the early 30s. I mean, looking at cholesterol, blood pressure, glucose control, HbA1c, those kinds of blood tests and blood pressure measurements are going to be useful earlier than we think.
Yeah, so being proactive and trying to seek out that help rather than waiting for your turn when you hit 50 and it's too late. Yeah.
Yeah, hopefully not too late, but but
Mm.
but certainly seeking and being proactive. That would be the way to go. Yeah.
Fantastic. Um, the question about stress. Stress doesn't really affect my heart. True or false?
Well, no, it does. Yeah, no, stress is an independent risk factor for developing heart problems. Yeah, it specifically affects blood pressure and sleep. It's sleep and stress both have adverse effects on weight and metabolic conditions. Yeah.
Brilliant. We've had a question about what your view is on vegan diets, as most of these are over processed and often under the guise of being healthy, but can be quite calorific themselves. Have you any thoughts about these?
Yeah, I mean, I would check the labeling around all of this, because I think there are meat substitute or vegan diets and various bits and pieces that are safe, but actually on the whole, they are quite harmful. They contain lots of processed ingredients, and the way that these things are put together are often very unhealthy, actually. So, and the amount of salt in these things can be quite striking, actually.
Mm. Um, you mentioned about diabetes. That's something that I focus on in general practice a lot, and I know there's a lot of patients in this chat who have mentioned, as a diabetic, how does this affect my heart, and really what risk is there to my heart if I don't have heart disease known about already? Could you elaborate a little bit about the risks there?
Yeah. Yeah. So if you have diabetes, then your chance of having a heart attack is similar to those that have already had a heart attack.
Mm.
So you're already at significant risk. So you're in a high risk category if you have diabetes. You want to try your best not to develop diabetes. If you have diabetes, you need to do your best to reduce your, well, you can actually, some people can try to reverse diabetes, go back into a pre-diabetes or a non-diabetic state, by controlling weight and body fat percentage and
Mm.
increasing muscle. So that is, it's well recognized that you can do that. There are friends and family that have achieved that. And if you're not of that, if you're not able to do that, you need to do your best to control your blood sugar. Because it is going to be toxic for you, sadly. It is going to be harmful, and that magic number that your general practitioner and other doctors will want to hear or see, the HbA1c, this reflection of what your blood glucose has been like over the preceding 3 months. This is a very powerful number, because that number helps everybody understand how good you've been in terms of controlling your blood pressure, not as an instance. So one's blood sugar can go up and down, but one's HbA1c is a very good predictor of how good someone has been over a sustained period. Yeah.
Mm. Yeah, very useful. All right, question about statins. A lot of chat on online in the papers about statins being harmful. Are they harmful? Do I need to take them to reduce my cholesterol?
Yeah, so this is it is really important to understand that some of the information available around statins, in particular primary prevention against a heart attack in those not had heart disease in the past, that can sometimes we historically statins have been overprescribed in that community, in that setting. But in general, if your cholesterol is elevated, or you have had a heart attack, or you have diabetes, or you are at particular risk in terms of your genetic profile or other things, of developing heart disease, really a statin is a very, very important and useful treatment to reduce your future risk of developing trouble. Statins not only work by reducing your cholesterol, which is something we can measure, but they have this thing called a pleiotropic effect, an effect on stabilizing heart artery disease in a way that we don't understand fully. And so they have been and will continue to be an incredibly useful treatment in prevention of future heart problems.
Maybe that's why diabetics and chronic kidney disease patients are also given statins these days, even if they don't have high cholesterol, for that same reason. I guess there's some questions about genetics, and it runs a lot. Heart disease runs a lot in Indian communities. How much is there that we can do about that, or are we succumbed to heart disease just because it's in our family line?
Yeah, I would strongly urge people not to be fatalistic about that.
Mhm.
Okay, so you can have heart disease within your family. You can have people in your family that have developed heart problems early in their lives, but really you can affect a lot of change. You can affect a lot of there's a lot of lifestyle and risk factor modifications that can go into the mix that can really reduce your chances of developing heart disease early in your life, and actually push that problem further down in your life, give you and more likely to have a longer and a better quality of life if you address lifestyle issues in the up front.
Mm.
So I would suggest that giving up or being fatalistic is really not the answer around that. No.
There's clearly a lot that we can do from your talk today. I think you talked about pressure, blood pressure, weight, wajan, diabetes, cholesterol, exercise or kasrat, diet, prokorak, mitu, salt, and of course smoking. So there's definitely risk factors that we can all work on and try and improve. It's not just because mom or dad or grandparents have had something that we have to have the same. Um, some questions. I'm not sure if you know the answer to these. I certainly don't. Is peanut oil healthier than any other oil?
Pass, you've caught me out on that one. You'd have to
Me,
look. You'd have to ask
me
somebody that
too.
knows. Yeah, but thank you
um,
for bringing in the Gujarati there. You've saved me on
no problem.
there.
Is Himalayan salt any healthier than any other form of salt?
No, I suspect that's not healthier than anything else.
And finally, the last question we've got time for today. Are heart attacks in women do they have any other symptoms than in men?
Yeah, yeah. I mean, this is actually something that we haven't, medical research. My daughter's looked at this, as part of medical research has sadly neglected half the population in research trials, very, very regularly. And one of the things around medical research and gender differences is lacking. Women do present differently. Actually, their symptoms are sometimes, when we describe something as atypical, i.e., not typical of a particular problem, actually may well be typical for half the population. Okay,
Yeah,
so I think women do have slightly different presentation ways of presenting with heart attack, but in general, actually, in general terms, they will present in a very similar way that men do. But sometimes women have different types of pains in the chest that might point to a heart problem. Angina is, a strong signal for angina or narrowings of the heart artery is the pain that occurs on exertion. So if you're getting it climbing stairs or incline, up hills, that pain really needs to be investigated, because that can really be a very strong signal.
sure. So the chest pain for sure, also the breathlessness on exertion, like you said, yeah. Um, Sorry, we've had a theme coming through. Just a thought before we end about ghee and whether that is a good, bad, or ugly alternative as a fat.
Yeah. Okay. This is a minefield, because what you don't want to do is actually substitute ghee with processed things, margarine and things like this that are substituting it with worse things for you. But ghee itself, yes, it's got a lot of the kind of saturated fats and so on that you want to try and limit. So, although ghee is a natural food and I support having natural foods, ghee in particular has a high concentration of saturated fats as well. So you need to limit the amount you have, but don't try not to substitute whole foods, natural foods, normal foods, foods your grandmother would recognize, with those that are processed, that are unrecognizable to somebody in their 50s.
Mm. Yeah, fantastic.
Sorry, somebody from the 1950s. Yeah.
Yeah, yeah, absolutely. Well, look, thank you so much, Niket Bhai. Just before we wrap up, I just wanted to add one more bit, but we have got a fair few viewers today that are from Europe, and also that means that some of the information that we've given may be slightly different in terms of 999 and calling the emergency services in the case of a cardiac arrest. So locally, the international number is 112. If you do see anyone with a cardiac arrest or symptoms of that, then please do call that. Other than that, I think we've talked a lot about habits, how we should change our perceptions of what is healthy and what is unhealthy, starting from a very young age. And of course, the 7 steps that you described about how we can try and avoid and change our behaviors to improve our heart health and prevent heart disease as much as possible. So thank you so much, Niket Bhai, for those insightful answers. We really are grateful. And we've really highlighted that some small changes can really lead to some big results. So starting small, being patient, and celebrating that progress. As we mentioned, oh, sorry, go on.
No, I was just going to say it's my absolute pleasure and my honor, and I'm delighted to be invited. I thank you to all those, including you, Nirav, and those that work so hard to develop this program, and it really is a testament to the care and dedication that you guys have. So it's a very, very insightful and very useful series of kind of talks that you've developed, and I'll look to join the next as well. Yeah.
Well, actually, on that topic, we have got another one coming up the next month, and next month's project will be on focusing on sleep. Something that we all need. We'll be hearing from experts about how to have better quality sleep and more effective sleep. The date's yet to be finalized, but details will be shared on Telegram and Sabah slides in the next few weeks. Thank you all very much for joining. We would like to request just a few seconds of everyone's time to fill in a very brief feedback form. The link will be coming across in the chat very shortly. But from the organizers and from myself and Niket Bhai, thank you all very much, and see you next time. Jai Saran.
Yes, all right. Thank you, guys.